Navigating a pregnancy brings this huge flood of information, a ton of excitement, and, let's be honest, a lot of questions. One of the very first and maybe most complex topics you'll bump into is antenatal screening. So let's dive right into this, using the official NHS guide to really unpack what these tests are, what they actually mean, and the choices they bring up. Right from the very start, the official guidance drives home a really crucial point. This whole journey is a partnership. Your healthcare team, they're your #1 resource. This entire process is built on talking things through. So seriously, never, ever feel like you can't ask a question, no matter how small it seems. And that's exactly what we're going to do right now. We're going to walk through that journey of questions together and break down all this information so you can feel a lot more confident and ready for those conversations. Think of this as your roadmap to understanding all your options. Okay, so as you kick off your antenatal care, one of the first things that's going to come up is testing. But before we get into any specific tests, there's this one really fundamental idea that we have to get our heads around, which of course brings us to the first big question.
This right here, this is the absolute key to understanding everything else that follows. Now, it might seem simple, but the difference between a screening test and a diagnostic test is so important because they're designed to do completely different things.
Okay, so let's tackle screening first. A screening test is not looking for a straight yes or no. A better way to think about it is like a sieve. Its job is just to catch anyone who has a higher chance of having a certain condition so that they can be offered more tests down the line. It's all about probabilities and assessing risk. All right, let's put them side by side. On the one hand, a screening test gives you a chance, a risk level. It's usually something non-invasive, like an ultrasound or a blood test, and the result is a number, a probability, like a 1 in 1,000 chance. On the other hand, a diagnostic test is all about getting a definitive yes or no. It's usually more invasive because it has to actually collect cells, and it's only offered if that first screening test flagged a higher risk. Okay, so now that we've got that key difference locked in, let's jump into the first trimester and see how this all works in the real world. The very first screening you're offered actually combines a couple of different things to start building a picture of your baby's development. It's called the combined test, and for good reason. It's a 2-part deal that's offered between 8 and 14 weeks of pregnancy. You've got an ultrasound scan and you've got a blood test. All the information from both of those is put together to get a single, more accurate result. Now, this first scan, it tells you a ton of stuff. I mean, it confirms your due date, it checks if you're having twins or more, it confirms a heartbeat, but it's also looking for one very specific measurement that's a key part of this whole combined test. And that leads us to a term you're definitely going to hear: neutral translucency. It sounds super technical, I know, but it's a really important piece of this screening puzzle. So what on earth is it?
So neutral translucency, or just NT for short, is basically just a tiny clear space of fluid at the back of the baby's neck. The sonographer measures how thick it is, and that number is then plugged into a calculation with your age and the hormone levels from your blood test. All of that together is what calculates the statistical chance of the baby having Down syndrome. The big takeaway here is that this measurement isn't the whole story. It's just one piece of a bigger puzzle. Okay, so you've had the combined test. Now what? You get your results. But it's not a simple positive or negative. It's all about understanding where your specific result lands compared to a national standard. So the result comes back as a ratio, right? Something like 1 in 1,500 or 1 in 100. Now, a lower risk result is pretty straightforward. Your chance is lower than the cutoff. But a higher risk result, say 1 in 100, does not mean your baby has the condition. What it really means is, if you had 100 people with that exact same result, only one of them would actually have a baby with the condition. It's not a diagnosis, it's just a flag that means you'll be offered more tests. And that brings us right back to where we started, right? That difference between screening and diagnostic. If your screening result comes back as higher risk, you then get the choice to go ahead with a diagnostic test to find out for sure, to get that yes or no answer. Okay, so the two big ones you'll hear about are chorionic villus sampling, which everyone just calls CVS, and amniocentesis. They both do the same basic thing. They check the baby's chromosomes, but they're done at different times and, they have different things to consider. First up, let's talk about CVS. With this test, they take a tiny sample of tissue from the placenta. And because the placenta grew from the same fertilized egg, it has the same genetic code as the baby. Now, the big plus here is you can get it done earlier, around 11 weeks. But there is a trade-off. It does come with a slightly higher risk of miscarriage, which is estimated at about 1 to 2%. All right,
Your other option is what's called an amniocentesis, or amnio for short. This one happens a bit later, usually from 15 weeks on. For this, they use an ultrasound to guide a really thin needle through your belly to take a little bit of the amniotic fluid that's around the baby. That fluid has some of the baby's cells in it, and those are the cells they can test for a final diagnosis.
And because this test is done a bit later in the pregnancy, the risk of miscarriage is a little lower. It's somewhere between 0.5% and 1%, so that's about 1 in 100 to 1 in 200. And that's really the decision a lot of parents have to weigh up, waiting a bit longer for the test versus that slightly lower risk.
Whew! Okay, so we have covered a ton of ground, right? From screening to diagnosis, from risk scores all the way to these specific procedures. But the most important thing to take away from all of this is what it's actually for. And I think this quote from the NHS guide is so important to keep in mind. It's a bit of a reality check. These tests are the best tools we have, for sure. But they aren't a crystal ball. They aren't a 100% guarantee. They're just a tool to help you understand and prepare. So at the end of the day, what do you do with this information? Well, for a lot of people, a lower risk result is just amazing reassurance. For people who get a diagnosis, it gives them time to prepare, to learn, to get ready for a baby who might have some extra needs. And for others, it can lead to the incredibly personal and difficult decision to end the pregnancy. The key thing to remember is that there is no right or wrong answer here. The whole point is just to give you the information you need to decide what's right for you and your family.
And really, that's what it all boils down to. All these tests, all this data, it's just information. It's not a rule book. It's not a set of instructions. It's just a resource that's offered to you as you go on one of the biggest journeys of your life. The only real question is, how will you use it to write your story?